An integrated delivery system, or an IDS as it's often referred to within the healthcare community, can take on many forms and structures. However, generally speaking, an integrated delivery system is a coordinated network of various healthcare providers, including hospitals, physicians, durable medical equipment providers, skilled nursing facility providers, and other ancillary services to provide a full spectrum of healthcare services for patients. Within an IDS, they're often able to bill for and collect the payment for services across the full continuum of healthcare services, which is different from fragmented providers that operate separate hospitals. The physicians are separate, and other ancillary providers are freestanding and bill for and collect for their own services as well. An IDS is able to structure compensation methods for physicians in a different manner, making it more economically efficient. For example, an independent hospital is paid based on a DRG from Medicare and other commercial carriers, and that means that they're reimbursed based on the diagnosis of the patient, not the amount of time or what's required to provide the service to the patient. This provides an incentive for the hospital to get the patient out of the hospital as quickly as possible. However, the independent physicians that are responsible for determining when that patient can be discharged are paid per unit. So every time they see that patient in the hospital, they are paid for that service. This sets up an incentive whereby they are encouraged to keep the patient in the hospital longer, putting the two often at odds with each other. Within an integrated delivery system, since the compensation methods can be distributed differently, and that system can bill for and collect for all services provided by the various providers, it becomes much more economically efficient. Integrated delivery systems are getting more and more attention due to the recent passage of healthcare reform laws. The laws that have been passed incentivize providers to work together and collaborate in providing population health management for an assigned set of patients. It basically breaks down the fragmentation that it has existed historically within healthcare, where providers operate in silos with separate information systems and separate data, and also decreases the likelihood that we're going to have duplication of testing, for example. This is not a new concept, however. In 1933, when we were spending 4% of our GDP on healthcare services as opposed to the 17% that we spend today, our country was at that time worried about our expenditure on medical services and assigned a committee to look at ways to better become more efficient in the delivery of healthcare. The number one recommendation from that committee was to better integrate healthcare delivery. So recent passage of healthcare reform is definitely bringing this to the forefront, but it is not a new concept.